plan for the second wave of COVID-19. It's a plan that delivers $2.8 billion in new investments to ensure our healthcare system is ready for the second wave of COVID-19. But as I've said before, it's the people who make a difference in the fight. It's the thousands of frontline heroes who put up their hand and put their community ahead of themselves. Because of these heroic efforts, we avoided the worst during the first wave. But as we enter into the second wave, and as our modeling shows, some of the toughest days lay ahead. We've been hard at work over the past few months to prepare for this very moment. As we enter the second wave of COVID-19, we need to stabilize our PSW workforce. We need to make sure that when our loved ones need care, whether at home, in a hospital, or in a long-term care, there's a PSW there to support them. And that means retaining our PSWs and getting more into the system. It means creating an incentive for more people to sign up as PSWs at a time when we need them most. It's absolutely critical. And that's why today we're making a landmark investment of $461 million to help stabilize our PSW workforce by giving over 147,000 PSWs a much-deserved pay raise. That means that as of October 1st, we're providing a $3 per hour more for 50,000 eligible PSWs in long-term care, for 38,000 eligible PSWs in home and community care, and for 34,000 eligible PSWs in children, community, and social services. We're also providing a $2 an hour more for 12,300 PSWs in the public hospitals. Today's funding is a first step that will provide a pay raise until March 2021. We're going to keep working with our frontline friends on the front lines on how we can continue to support our PSWs, because our PSWs deserve our appreciation and respect. They're doing a heck of a job, and I want to give a special shout out to all the PSWs today. Thank you for everything you do, and I absolutely love you guys. I really do. You're amazing people. You're absolute champions, as I always say. If you see a PSW this week, please be sure to thank them. And we're going to send them reinforcements. We're recruiting over 2,000 more PSWs through our fall preparedness plan. We're putting 3,700 more boots on the ground to support our healthcare system. But all of us have a role to play in fighting the second wave, in stopping this deadly virus from spreading. Yesterday's modeling data was a wake-up call. We could have 1,000 cases a day by mid-month. So again, I have to keep saying, please don't let your guard down. Please follow the public health measures. Think about the PSWs and everyone working 12 hours a day on the front lines. Think about your grandparents, your parents, friends, and family members. My friends, we're all in this together. Please keep doing your part so we can all stay safe and healthy. Thank you, and God bless the people of Ontario. Now I'll hand it over to Minister Elliott.
Thank you, Premier, and good afternoon. Our government's top priority throughout this pandemic has been to protect the health and well-being of all Ontarians. That commitment has always included our frontline healthcare workers who have gone above and beyond to help patients throughout the COVID-19 outbreak in Ontario. Personal support workers, or PSWs, and direct support workers care for some of our most vulnerable patients and have been critical in the fight against COVID-19. That's why our government is proud to be investing $461 million to increase wages temporarily for over 147,000 eligible PSWs and direct support workers. With this investment, we are enhancing wages for eligible workers that deliver publicly funded personal support services in home and community care, long-term care, and public hospitals, as well as similar direct personal support in the social service sector. This wage enhancement will start today. Our government wants to ensure our healthcare and social services systems can attract and retain the workforce needed to care for patients, clients, and residents in response to the COVID-19 pandemic. This investment builds on the province's COVID-19 fall preparedness plan, which includes an investment of more than $26 million to support PSWs and supportive care workers.